Hello, good morning, dear colleagues. It is a great honor to be here in front of you and present. I'm Dr. Nini Dvali. I'm from Tbilisi, Georgia, and today my topic of presentation will be cross-linking post-LASIK in special cases. I would like to start my presentation with a controversial question. Is LASIK always contraindicated in patients who are diagnosed with keratoconus? Let's dive into it. So, keratoconus, progressive bilateral ectatic corneal disorder, usually onsets in teens or 20s, and we all know the most common symptoms. It's low visual acuity, usually at far distance, the keratokyphosis, excessive eye rubbing, ghosting, inability to see well, even with correction. And there, if we talk about etiology, there are genetic and epigenetic factors and many more interesting nits and bits that I will not get into right now due to time concerns. But I would like to point out that thankfully nowadays we have a whole plethora of different treatments, both conservative and surgical, and their combination available. These patients on this slide are all our own patients operated in our clinic, treated by one or another method or the combination of them. Today I will talk about LASIK and cross-linking combination, and I would like to point out once again that I did not do this. Sorry. I need this one. So cross-linking is one of the, if not the most popular, budget-friendly, straightforward, and effective treatment for stopping the progression of keratoconus. And stopping the progression is the keyword here. Currently, it is also used as a treatment for ectatic disorders like pellucid marginal degeneration, iatrogenic ectasia, usually post-LASIK, and it has also been used successfully in the recent years as a treatment for drug-resistant bacterial keratitis. And here is the whole idea behind my presentation and behind our treatment method. So if this treatment method, in this case cross-linking, can be used effectively to treat an already existing corneal ectasia, why not get ahead of us and use it as a preventative measure in patients who are likely to develop ectasia after LASIK? So cross-linking also has a good regularization effect on corneal topography, but the main idea is that it freezes the cornea in its current state. And this is important because there are a lot of patients who are seeking LASIK, but sometimes we would refuse them because we think that they are high risk for corneal ectasia post-LASIK. And more commonly, you can predict patients who will develop ectasia after LASIK, and here are some subgroups of them. First are people who have suspicious corneal parameters, so they are healthy individuals. They don't have keratoconus, will probably never develop it unless we alter the corneal biomechanics with LASIK. People who have a form first keratoconus, subclinical or stage 1 keratoconus, or people with pellucid marginal degeneration. So we actually perform LASIK in these patients if the residual stroma postoperatively is more than 300 microns. This is general rule of thumb. And so not to bore you with any more theoretical stuff, I would like to present a case. This is our patient who presented first time around 2 years ago. He had poor distance visual acuity for all his life. He never wore any kind of correction because he was unable to tolerate glasses, and he came in asking specifically for LASIK. You can see all the details of his examination. I would like to point out that his best corrected visual acuity was 0.5 in both eyes. His pachymetry was normal. If you see here, he was diagnosed with keratoconus by us in right eye, so stage 1 keratoconus, but his pachymetry was normal. So because patient really wanted to undergo LASIK, he was not our first patient. We had years of experience in this method, so we decided that we would perform LASIK and honor the patient's wishes, but only condition is that 3 months after LASIK, he would come in to have a cross-linking performed on his right eye. And this is what we actually did. So we installed lacrimal plugs, and we do it in every patient with keratoconus who has to undergo any kind of treatment. Then we performed LASIK on both eyes. You can see postoperatively that refraction was really good. The visual acuity gained after LASIK was also on right eye a little bit more than we expected. On left eye it was 20/20. In 3 months he had cross-linking on the right eye, and 1 year after surgery you can see his results are perfect. The visual acuity is 0.7 and 20/20 in the left eye, because and this is his corneal topography. You can see this is 2 years after surgery. It's very adequate to the post-LASIK state. The patient is doing well, he is happy, and we are also happy. The take-home message here is that we all know that LASIK is a blessing. It is great to improve the quality of life and to improve the vision of our patients, but it makes corneas weaker. We all know that. So why not why not do cross-linking in the patients who are good candidates for LASIK, other than this, they're a little bit specific corneas, and then have a little bit more armchair time with this patient, and to say that we need to perform a second step of this treatment plan, which is planned cross-linking in 3 months, to have twofold, which serves twofold mission. One fold is to prevent the development of ectasia, and the second one is to maintain this really good high visual acuity and freeze cornea the way it is after LASIK. Thank you very much, and I'm ready for questions.